the Fall Mastermind. Today in the Mastermind, we're going to go over cerebellar assessment. We're going to go over the visual drills, the vestibular, go into cranial nerve testing, and then into mechanical vestibular assessment and correction. So the first section we're going to do is look at the cerebellum since it is connected to the visual and vestibular system. And the four tests we're going to use is we're going to use the Sharp and Romberg, we're going to use the Fukuda step test, we're going to use rapid coordinating movements or RCMs in the upper extremity, and we're going to use finger to nose testing. So the first test is our Sharp and Romberg. We're going to stand with one foot in front of the other, arms out like zombie arms, and we're going to close the eyes for 10 seconds. Now, a lid of this way is normal, but what we don't want to see is a fall to one side. And if we do have a fall to one side, we're going to switch the feet because it could be a proprioception problem. We switch the feet, then it might be a bottom-up control issue. Now, if there's consistent fall to one side, it could be, most likely, inhibition of the cerebellum on that side towards the fall. But it could also be an overdrive of the cerebellum on that side, and that's why we're going to stack test all these tests. The next test, we're going to do a Fukuda step test. We're going to go eyes closed, 30 steps. Now, when you're doing this with your clients, don't count out loud because they can hear your voice and they can orient themselves to where they are. So we're looking to see, is there any drifting on one side or is any forward pull? This is indicative of maybe some top-down control. Maybe there's a miscommunication in the visual and vestibular system as well. The next one is our RCMs, or rapid coordinating movement. We're going to look at the proximal joint of the shoulder, and then we'll look at the elbow. So again, eyes closed, fingers nice and tight. Pretend there's a rod straight through the arms, and we're going to spin at the shoulders for about 10 seconds. And what we're looking for is any kind of deviation, any kind of flippering on the one side that could be indication of down regulation of the cerebellum on the same side. If your client has a shoulder issue, you can use the elbows. Okay? So both options are available, and we're looking to see fatigue and discoordination on that symptomatic side. And then the last one we're going to do is we're going to do fingernail fingers. So you're going to give the client the target to hit, your finger on the side, and we're going to use the ring finger side to the nose and then coordinate on touching the finger. And here, the reason why we use the index finger, the ring finger, is because it's less integrated in the sensory motor cortex. So because we use it less, it's less familiar. So we're trying to sensitize the test as much as possible. And what we're looking to see is if there's any stalls, stutters, or overshoots when the client's looking to hit the target. And then you test both sides. 10 reps to see if there's any fatigability, right versus left. Now, if there is the cerebellum on one side, we'll see a consistent or lack of coordination on the same side. So we have right side cerebellar inhibition, Sharp and Romberg, fall to the right, Fukuda, turn to the right, discoordination on the right side. Okay? And also RCMs will be a little bit slower, a little bit sloppier. Now, if it's an overdrive on one side, say we see a Sharp and Romberg fall to one side consistently, but then we go over and we look at the RCMs and it's on the left side, or Fukuda turns to the left. Well, that could be an indication that there might be overdrive where the cerebellum is pulling the client over. So it's not an inhibition, it's an overdrive. So what we need to do is do downregulation, stretching, manual therapy on that side rather than just upregulating. So everybody pair up and test your clients and then make note of what your findings are, because then we're going to stack in the visual and vestibular testing to see what kind of picture we can create with the clients.